Okay, let's get into it. So we're going to talk about the very first thing is the stages of shock. We're going to talk about, let's get into the nitty gritty of shock. So the first one we're going to start out with is asymptomatic. So asymptomatic is basically nothing's wrong with you, right? This is what norm would be. This is your baseline, how people look at when you come in to see if they're asymptomatic, where they have basically, they're probably not even going to go see these people because they're probably not calling you. But so we need to understand what normal would be or what asymptomatic is so we fully understand it. So they'll be alert and orientated, right? They can have conversations, they can answer your questions appropriately. Their breathing rate is going to be between 12 and a 20 depending on what they're doing. It's going to be regular. And their heart rate is going to be between 60 to 100 a minute. And it's going to be probably strong at the wrist, and you're going to easily be able to find their pulse. Next, their blood pressure is going to be 120 or 60. It's just going to be within the normal range. And because of all these working, they can perfuse their body. So they currently don't have any shock. But when we kind of look at this, we got this green line down here, and then we got our shock blocks. They're all stacked up on top of one another. And basically, when all the blocks line up, the patient's asymptomatic or the person's asymptomatic. So the big thing is that when everything's working really well together, we don't have shock, and these people are probably not the ones that are calling us. So again, this is kind of like the effort of treatment. There's no treatment because it's a nice green line. So next is in the line is behavior change. And usually behavior change is one of the first signs of shock, right? You show up, the patient looks well, they may not exhibit any other signs, their blood pressure might be good, their rate might be good, but they might be just slightly confused, they might be a little anxious or a little agitated, and they might be just not acting as appropriate for themselves. Also, if they have a significant other or partner, they might be just saying that the person's just not acting right. So again, first of all, start looking for this alertness, restlessness, anxiety, just not behaving correctly. Again, breathing rate is usually the same. They're not short of breath. They're not working to breathe. Pulse is usually in the same space. So when you feel the pulse on the wrist, that it is 60 to 100 and you can feel it, it's usually strong and regular. Next would be blood pressure is the same. They got like blood volume. Their skin color is going to be pink, warm, and dry. So basically, it's just the first start of shock. Sometimes it's behavioral change versus anything else. So the part that comes with behavioral change is so we got our 4 shock blocks, depending which block is out at that time. Right now, the treatment effect, you can actually make a lot of difference if you notice that they're starting some type of shock symptoms and if it's just behavior change. It might be like if somebody's very short breath, and maybe they're kind of hypoxic just starting, and you happen to give them some oxygen, you're going to find that it's easier to control that stage of shock or actually stop the shock from progressing. So basically, a change of behavior like anxiety, agitation, slight confusion, maybe just that signaling you that there's a change or there's a start of shock. And early recognition of shock is so important because of this treatment effort. The sooner you catch it in where it's not as severe, it's easier to treat. Compensating shock. So this is the one where we got shock happening. So shock is actually happening. One of these blocks is not functioning correctly. You are having a decrease in perfusion. So whether it's your heart, your lungs, something along that lines, one of these blocks are starting to get out of place and making things off balance. For the body to maintain that, there's called compensated shock is because the body's going to compensate for that one. So if you're having a problem breathing and getting that oxygen in, the heart rate's going to increase, right? They might increase the blood pressure a little bit. Heart rate will increase. That way you can push more oxygen just by sheer quantity. So if you think of compensated shock, they're usually going to look anxious, a little agitated, slightly confused maybe. They're not altered, but they're usually going to answer questions correctly, but it might take them a little longer. Breathing rate's going to increase, depth's going to increase. This is where they might start looking like short of breath with an increased working to breathe, depending on what they're trying to compensate for. Next is the heart. Heart rate will increase. They're going to become tachycardic, right? We're not talking about like an SVT or a atrial tach above 150, 100, and then they're going 180. Once we're getting above that 160 mark, we got to wonder if it's really sinus tach or whether it's actually an arrhythmia. And basically, they're going to have usually normal blood pressure, maybe slightly low, and it might even be elevated just a little bit. but this is where they, a lot of times they could be pink, warm, and dry, or you can see as they're starting to get to the end of the compensated shock spectrum that they might be start getting some pallor, they might look a little pale from one another, they might have poor cap refill as well. They also might present with some nausea and vomiting, and that's very common. Even though they haven't had any GI problems, the nausea and vomiting is what's kind of a trigger too. And this might get worse, the nausea and vomiting might get worse on exertion or if you raise their head. So again, compensated shock. Talking about the treatment effort, you notice how the lines increase more. So now we're in compensated shock. So this means that this patient system's now unstable, right? We're starting to the block, to get that block back in place, or now you might have a couple blocks working, and now we need to go in and support those blocks to get them and push them back into place. The hill's getting a lot steeper, so it's gonna be harder to get those into place. So also talking about decompensated shock. So decompensated shock, well, basically it's decompensated. The systems are starting to fail, right? So the system is under a lot of stress and it can no longer maintain good perfusion or moderate perfusion. Compensated shock is doing that, where decompensated means these are starting to fail. So what we're going to see there is altered LOC. They're going to be harder to arouse. They're probably not going to answer questions correctly. They might be even more agitated, even aggressive, right? But they're not going to be up running around usually, to the point where they're unresponsive. The respiratory rate, where normally was probably pretty fast, now it's slowing down because the body's starting to fail, it's starting to fatigue, so it can't maintain what they need to do. So it's going to slow the respiratory rate down. This is a good sign to start paying attention that you are, leading to irreversible shock as well. The pulse is going to get weaker. You may not feel it at the radials anymore. You may not get them at the brachials. They might be up in the carotid. It may become irregular because the heart isn't getting, it might be a heart thing, but the heart might become irregular because it's not getting enough oxygen. If, say, it's an asthmatic and they're actually fully starting to fully close off, where they're not getting very much oxygen in, and we've been building up CO2. And again, patient's usually going to be hypotensive by this point. Their pressure is going to be quite low. You're looking at the systolic of 70, 60 possibly, and we got to figure out what the next step is. Their skin is definitely going to be pale. They're going to have cyanosis. And basically, these people are not going to look well. These are the people that when you walk into the door and you go, they're sick. Right away, you'll know about these people. And again, sometimes they'll have some nausea and vomiting if they're awake. That's, just something to look for as well. So decompensated shock, the treatment effort, as you can see here, is much higher. That obviously the line's getting steeper and steeper, and it's kind of like when we talk about pushing a rock up a hill. So we probably have multiple now blocks that are at a place that we're going to have to stabilize to actually maintain some type of perfusion. So basically, when we're talking about decompensated shock, this occurs when the body can no longer adequately get blood flow that has the oxygen, the nutrients to all those end organs and tissues to keep them alive. So the things start failing even faster at this point. So when it comes to treatment effort, it is a lot more harder when we get to this point. So early recognition, if we can see shock way before it happens, like when we're talking about at the beginning, maybe it's just mechanism of injury, they have no signs or symptoms at that point, they're symptomatic and they had a high traumatic injury, and we know that shock is coming, maybe we need to get on top of that and get ahead of it. And that way we don't get to decompensated shock. Sometimes it's just easier to block those blocks early on than it is when we get to this point. But let's be real, we do calls, we show up, and they're already in decompensated shock. So again, irreversible shock. Maybe somebody fell down over there, but I'm not sure. Anyways, we'll just keep going. I'll check them out later. Anyways, so irreversible shock, pre-cardiac arrest. This person is about to cardiac arrest on you. So you have to understand that as you're going from decompensated to go to irreversible shock, this is where all the wheels on the bus fall off. And we're going to have to start picking up all the pieces, and there's going to be a lot of work. So at this point, if you're a BLS provider or even an ALS provider, you're probably going to need some more hands to make this thing work. So let's take a look at what we got. You're going to probably be an altered level of consciousness easily. Probably at this point, they're going to be unresponsive, maybe responding to some painful stimuli. And then they're going to show slow, regular, shallow breathing. They might get into irregular breathing where they got some Kussmaul's. They might be gasping. So if you see some kind of gasping or this apneic gasping between breathing and not breathing, make sure you're checking a pulse. You might want to start CPR at that point. Next, they're probably going to have slow pulses. You're probably not going to get them at the wrist. You're probably going to have to go up to the carotid, feel them with a femoral. They could be irregular as well, because if the heart isn't being oxygenated enough, we're going to start getting some type of arrhythmias. And again, these people are going to be extremely hypotensive. We're talking like their systolics in the toilet. Their skin's going to look ashen, kind of, they might have a gray appearance to them. They're going to have mottling, maybe peripherally or centrally, depending on what's going on. And it's one of those things, and they're definitely going to look a little cyanotic. So again, when we're talking about treatment here, you notice how this line just goes straight up. It's almost straight up. Once we hit this irreversible shock, it's really hard for us as EMS professionals to actually get these blocks back in line so we can get back to maintaining perfusion, right? There's death of cells occurring at this point, and it's really hard to make that recovery. So those are the stages of shock. The steps, that severity, going from where you don't have any signs of symptom of shock, person's perfectly healthy, right to reversible shock where you're pre-cardiac arrest or actually probably in cardiac arrest. And what we're going to do in the next few videos is go over all the different types